Can hypertension after bypass surgery cause stroke? Have you ever wondered how high blood pressure can impact recovery after heart surgery? Let's take a closer look at the relationship between hypertension and stroke risk, especially after coronary artery bypass grafting. Hypertension, or high blood pressure, is a known risk factor for stroke. This is particularly true for patients who have recently undergone bypass surgery. Studies show that the risk of stroke is especially high in the first 30 days following the surgery. In fact, the risk peaks just 2 days after the operation and remains elevated for several weeks. Why does this happen? High blood pressure can damage blood vessels and lead to a condition called atherosclerosis, where plaque builds up in the arteries. This buildup can block blood flow to the brain, resulting in an ischemic stroke. Patients who have hypertension after bypass surgery are more likely to experience these types of strokes compared to those with normal blood pressure. Several factors contribute to this increased risk. First, poorly controlled hypertension can lead to embolism, which occurs when clots or debris block blood flow. This is particularly concerning after surgery when the heart and blood vessels are healing. Second, hypertension can cause cerebral hypoperfusion, meaning there is not enough blood flow to the brain. This can happen due to fluctuations in blood pressure during or after surgery. Another important factor is atrial fibrillation, which is an irregular heartbeat that can develop after heart surgery. Hypertension is a major risk factor for this condition. When atrial fibrillation occurs, it increases the chance of clot formation, which can lead to a stroke. Additionally, many patients with hypertension have other health issues that can further raise stroke risk. These may include older age, diabetes, and a history of previous strokes. Each of these conditions can compound the effects of high blood pressure, making it even more critical to manage it effectively. So, what can be done to reduce this risk? It is essential to manage hypertension aggressively both before and after bypass surgery. This includes regular monitoring of blood pressure and controlling any arrhythmias like atrial fibrillation. Surgeons can also take steps to minimize aortic manipulation during the procedure, which can help reduce the risk of embolic events. In summary, hypertension after bypass surgery does increase the risk of stroke through various mechanisms. By managing blood pressure and related cardiovascular conditions, patients can significantly lower their stroke risk and improve their recovery outcomes.